Welcome to Shape of the City, a program on health and wellness topics relevant to the Lincoln community. I'm Clover Frederick, and I'm your host. It's time again for open enrollment for the health insurance marketplace. Who should be signing up and when? I have with me today Andrea Haberman with the Lincoln-Lancaster County Health Department and Aaron Bowen with Community Action Partnership of Lancaster and Saunders counties. Thank you so much for joining me today.
Thank you.
Thank you.
Now let's get started with you, Andrea. Tell us a little bit about what the marketplace is. How does it work?
The marketplace is a way people who are uninsured can get health insurance. And you can do that through, there's basically 4 ways you can enroll in a health insurance plan, and that's through the mail. You can get a paper application, through the website at healthcare.gov. You can call in and talk to somebody over the phone about enrollment, or you can get in-person assistance by a place here in Lincoln, Nebraska, which hires people that can help you with that. And we have 4 places in town where you can go and get in-person assistance.
Okay, very good. Now, who should be considering checking out the marketplace?
Yeah, generally people who are uninsured. Most of us have employer-based insurance, about 60% of people. If you have insurance now, you don't need to go on the marketplace. If you have Medicaid, Medicare, veterans insurance, you don't have to go on the marketplace. So it's really just for people who are uninsured.
Okay, very good. Why is the marketplace such an important resource for the community?
That's a great question. It's very important because if you have health insurance, you have a way to pay for health care. And health care can be expensive. In fact, a 3-day stay in the hospital can be about $30,000. To get a broken bone fixed, like a big leg bone, it costs about $7,500. That's very expensive. If you don't have insurance, you have to pay all of that cost out of pocket. If you have health insurance, your health insurance company has negotiated with healthcare providers to get you a lower cost. So if you and I both had the same we were both having the same health service, if I was insured and you weren't, I would be paying about 40% less for that service than you would. So it's a way to get health care at a lower cost.
Okay. Now, what are some of the important dates that people need to keep in mind about the marketplace, because it's not open year-round?
Yes, right, exactly. There's a shorter period of time. It's November the 15th of this year till February 15th of 2015 when it's open enrollment. And during that time period, people who have not had health insurance can get on, and people who were insured last year through the marketplace can go back and shop again for health insurance.
Okay, now if somebody is returning to the marketplace from last year, what should they know?
They should have received a notice from their health insurance company, and that's a very important notice to keep track of. It has a long number on it that you will use when you go back into healthcare.gov to either re-enroll, and you can be automatically re-enrolled. If you like your plan, if it's still offered, you will be automatically re-enrolled. But it's still a good idea to go in and make sure all your information is current, like your income, whether you're employed or not, if you've gotten married, something has changed, you've adopted a child, something like that. So it's very good every year to go back into the marketplace website at healthcare.gov and make sure that all your information is correct. Now, why that's important is because if your income has changed or you're adding family members, your premiums or the cost of buying healthcare insurance could actually be lower this year than they were last year. So you want to make sure you're getting the best deal. And you also want to make sure that if your needs have changed, you might want to move over to a different health insurance company. So you have the right to do that every year. So people should get into the practice of looking at their health insurance plan and policy every year.
Okay, now we heard some things last year about the marketplace website not really being up to snuff. So
yes,
what's changed since last year?
Well, it's much improved.
Okay.
If you go on the website, which you can right now because the marketplace is open right now, you can tell there's been a lot of improvements. It's a lot more user-friendly. There are tools to use when you put in your income that will tell you about how much you'll pay in premiums per month. There's also very good tools if you are an immigrant that will talk about what documentation that you will need. And they even give examples of what that documentation looks like, because that can be very confusing. So they really have a lot of self-help tools that were not available last year. And just overall, the wording, the context is a lot easier to understand. Health insurance is very confusing. So they've really worked hard on using more understandable terms.
Okay.
So much
Very
improvement.
Good, good. Now, you did say for people who would feel more comfortable talking to somebody in person about their health insurance needs, that there are 4 locations in Lincoln, which we'll put resources up on the screen for those 4 locations. But one of those locations is Community Action Partnership. So, Aaron, tell me a little bit about Community Action Partnership and how you are helping with the marketplace.
Well, my agency serves 2 counties, Lancaster and Saunders counties, and so last year when the marketplace first began, with a federal grant that came through Community Action Nebraska, which is the state association for all 9 of the state's organizations, we were able to access federal funding to begin our Navigator program, which basically there are certified application counselors and there are navigators. The primary difference is a navigator does more outreach. But at Community Action this year, we're going to have 7 individuals who are trained. 6 of those will be certified application counselors. 1 will be a navigator. 6 of those folks will be available in Lancaster County and then 1 in Saunders County. So for folks in Saunders County, the best thing to do is to call Community Action at 471-4515. You know, I think the main thing we want to stress to people is don't delay, even though it goes until February 15th. Sometimes there are glitches. Sometimes you may have questions on your application. To make sure to call and ask for a health insurance enrollment appointment at Community Action. We'll be able to schedule you a sit down with somebody to go through things. Appointments take generally 45 minutes to an hour and a half, but it's going to depend on your certain situation. And if you just have one question, give us a call. It's great to sit down with someone, or you can call the toll-free number with the marketplace. We're also looking for volunteers to expand the number of people we have available to assist, because there's going to be a lot of people coming in. We want to make sure we get to everybody, because that December 15th deadline for January 1 coverage to begin is looming. And so don't delay, get in as quickly as possible. Also, we're going to have Wednesday evening appointments available, and we'll have available appointments in Spanish. And I hopefully the community, we want them to stay tuned. We may be able to put together a December 13th community event right before that December 15th deadline to make sure that people who have waited till the last moment can get that assistance. But I think overall for Community Action, we serve primarily families who are of low incomes, and health is a huge concern for them, especially the costs that Andrea was talking about are astronomical for families who aren't expecting this, and if they don't have a go-to doctor, they end up utilizing emergency room care for a lot of those things, which we all know is much more expensive than preventing those emergencies or getting care when they need it.
Right. Now, what other resources are available to people who are interested in the marketplace?
Well, number 1 is to go to the website. We stress to everyone, whether they call or come in, to check it out first. You can call the toll-free number. You can fill out paper applications, but I think the best thing to do is to talk with someone one-on-one. I think last year we learned that people would come in who had paid thousands and thousands of dollars in premiums over the year, never thought they would be able to qualify. And it's important to know that every plan in the marketplace is going to cover essential benefits. There are no pre-existing conditions. And so folks who never thought they would have insurance, or it wasn't possible, or it would cost too much, we've seen so many people come in and it's available to them, and it's at a far lower cost than they ever expected.
Now, a lot of Nebraskans got signed up in the marketplace last year, didn't they?
Yes. Actually, that's very exciting. About 44,000 Nebraskans enrolled in the marketplace in the last open enrollment period. And what's really encouraging about that is 7 out of 10 of those people, nearly 7 out of 10, received help so that they pay no more than $100 per month for their premiums. That's quite a deal. And we know that this year, if you're re-enrolling in the program, that you want to make sure you're very careful in canceling your old coverage and then getting on a new policy. So it's very important to make sure you don't have 2 policies going at the same time. You need to cancel one and then enroll in a new policy.
Okay, very good. And there are some online resources available, correct?
Correct. We've made some videos with a local flavor to them to talk to people about what's available locally for you for help in the marketplace. And those are on Channel 10 Health YouTube.
Okay, very good, very good. Well, thank you both for joining me today. We look forward to all the people you're going to be helping through with the marketplace. Thanks a lot.
Thanks, Clover.
Thank you.
We'll be sure to list those resources on your screen. And when we return, we'll be talking to some people who are working on a great program to help with children's health in our community.